It's not just Greater Sydney facing lockdown. Dubbo's locked down until the 19th of August. In the Northern Rivers, 4 local government areas are locked down until the 17th of August. So is Tamworth. Armidale will come out of lockdown a couple of days earlier on Sunday the 15th. Newcastle and the Hunter are due to exit lockdown this Friday. There are 110 active cases across regional New South Wales. The concern is that those cases will spread. Late today, a person in Walgett in the northwest of the state tested positive. Walgett has a large Indigenous population. The infected person was also in Dubbo and the Central Coast while infectious. Walgett, Bogan, Burke, Brewarrina, Coonamble, Gilgandra, Narromine and Warren will now go into lockdown from 7 p.m. tonight. Stephen Lawrence is the Mayor of Dubbo Regional Council and Michael Lyon is the Mayor of Byron Shire Council. Thanks to both of you for being with us tonight. Stephen, first to you. Dubbo's in lockdown, Walgett's gone into lockdown. Walgett has a large Indigenous population. Can you give us a sense of what the vaccination rate is like out there in regional New South Wales?
Yeah, look, it's climbing, Leigh, but we're significantly behind, and that is because we haven't been prioritised, understandably, given the non-existent rates of community transmission to date in Dubbo. But hopefully the events of recent days means that we move up the calculus in terms of the public health equation.
Have you had any word from the state or federal government as to when you could expect more supply of vaccines out there?
Yeah, look, we had some good news, which was that the Pfizer vaccines, which had been planned to be moved to the city, ended up staying out here, which is good. And we know that 1 million Moderna doses are arriving in the country soon. So the vaccine rollout will continue in regional New South Wales. And Leigh, you were saying before about the large Aboriginal communities in Walgett and so forth, and our big Aboriginal community in Dubbo is very connected to those Aboriginal communities to the north and the west, and those communities are very vulnerable. So the events of the last 24 hours really troubling. So the vaccine rollout just so crucial to protect those vulnerable communities.
Has there been any vaccination out there in those vulnerable communities?
Oh yeah, absolutely. It's occurring, but it's significantly behind certain other more urban places, and that's, you know, quite logical in one sense. We've had very low rates of community transmission, but the events of the last 48 hours or so, certainly I hope that that changes.
And Michael Lyon, what about where you are in northern New South Wales? What about vaccination there?
I understand that we're slightly under the state average, but that's to be expected, obviously, with the prioritisation of Sydney. But we're tracking reasonably well, I think, compared to other regional areas.
Is there any vaccine hesitancy in northern New South Wales?
Oh, look, that's undoubtedly the case. I think that's across the state, but we certainly are. We do have a fairly good percentage of our population that are vaccine hesitant, yes.
Is there anything that you can do to get around that, or is there any kind of public or community campaign that's going on that you think could work there?
Well, look, I think possibly, and I think with our latest outbreak, I think that will really, for a lot of people that are just sort of sitting on the fence or you know, could go one way or the other, I think that will definitely tip the scales in that sense. So we're certainly seeing that in terms of the current lockdown and the amount of people that are now really complying with the public health orders, which is good to see. So, look, I think that will tip the scales, absolutely.
Can I ask each of you as well about how well you think your regional hospitals are set up to deal with this? Michael first.
Well, I've been following a little bit of information on social media, and it's hard to say for sure, but what I can tell is that Lismore Hospital is almost at capacity already. So I think if we were to go through any kind of outbreak at all, that would immediately put pressure on our hospitals.
So Lismore's, sorry to interrupt. So Lismore's at capacity with not really dealing with COVID at all currently, just dealing with regular illness.
That's my understanding.
Okay.
Absolutely.
And then Stephen Lawrence, what about where you are?
Yeah, look, we have had no community transmission, so our hospitals have not been tested in that sense. But look, our lower concentrations of population, our different economies of scale mean that if there is a large-scale COVID outbreak out here, our hospitals will come under incredible pressure, and that's why it's so important to contain and eliminate it. I think we have a lot of advantages in containing it. We've got a very cohesive population. Our media concentrations are really there. The messages are getting out. And that's fortunate because we are incredibly vulnerable, and part of that is the nature of the public health system.
Well, fingers crossed for both of you. Thank you very much.
Thanks, Leigh.
Thanks, Leigh.
Hi, I'm Leigh Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.